Hi, Professor Lenowitz. My name is Brandy, and I will be presenting our paper on fundamental principles of care coordination. Care coordination is considered a vital key to improve and enhance care quality, and several factors affect the coordination of care in health facilities. The guiding factor of the patient-centered medical home model affirms that the coordination of care should be practiced across the patient's community and the healthcare system. With the growing number of chronically ill patients, care coordination has become a fundamental aspect as the healthcare system is becoming fragmented and more complex. Achieving care coordination comes with a full package of benefits, including improved quality management of chronic disease care, reduced hospital admissions, and improved patient satisfaction. The patient education program is a strategy that effectively collaborates with the families of the patient and the patient themselves. This experience is designed to help people prevent illness or improve their health by gaining knowledge and influencing their attitudes. Through this strategy, COSTA suggests that patients can collaborate with their healthcare givers to gain more information through a secure online platform. Healthcare givers can collaborate with patients and educate them to promote medical education adherence by properly explaining how to take the medication and when to take medications. Healthcare providers ought to discuss the reluctance of taking medications with the effects it comes with and with the patients themselves and family. A good example of a drug-specific educational interventions is the ARV's educational program, where the patients gain knowledge on the increased viral load due to medication non-adherence. More so, patients in a medical facility get educated on their health conditions, and they collaborate with their physicians and form shared decision-making protocols that enhance the continuum of care. Another strategy is the family support intervention that aims to consult, inform, partner, or support the family members of patients with severe illnesses. According to MIR, the interventions involve experienced and specialized professionals to offer quality care and information on the coordination of care and the health status of the patient. Family members can also receive support and help based on key factors of respect. By collaborating with the healthcare givers, a mutual agreement of what is helpful to the patients is achieved. Shared decision-making is another strategy that allows physicians and other health facilitators to collaborate with the patient and their relatives in formulating the best and important health decision in fights of regaining a patient's health to normal. Through shared decision-making, health professionals can share critical information on the available evidence of the practice and other repercussions that may arise. The strategy assists healthcare providers with vital information concerning culture aspects, values, and patient principles. Another strategy is personalized care planning, where a negotiation is a discussion between a healthcare provider and the patient is held to clarify preferences, goals, and options, and develop a consensus plan or action based on the mutual understanding. Personalized care planning ensures that the patient is also a part of improving their health, which greatly affects their attitude towards regaining their health. Through this, patients cooperate in taking medications and following medical procedures effectively. Change management requires planning to have a steady flow of patient experience that is vital to the provision of a patient-centered care. To maintain high-quality care in the process of change management, health facilities ought to improve preventative care services, reduce health disparities on their patients, as well as close care gaps. More so, there are existing gaps between the suggested best practice in offering healthcare and the care that is delivered. Effective changes should be put into place to effectively close such gaps that will improve clinical culture, information technology support, and effectively in staff workflow. Other aspects of change management are creating a guiding coalition that will help maintain high quality care services in the process of change, developing strategies and vision that will assist in the maintenance of ethical practices, communicating the change vision, and empowering employees for broad-based action or other aspects that will assist them in adapting to the changes. Improving patient care outcomes are fundamental on various factors that the healthcare practitioner ought to prioritize to achieve in a more ethical decision. Coordination of care is majorly influenced by the practitioner's knowledge and skills, adherence to the code of ethics, as well as proper collaboration between healthcare givers with patients and their families. The involvement of several specialized parties characterize care plans, coordination, and there is an issue of sharing patients' information through the involved individuals. The sharing of patients' information requires a high understanding of the ethical implications and what is rightful. Making certain decisions is the coordination of care requires the ethical principles of patient consent. Without the patient's consent, health practitioners may suffer the repercussions of breach of information that may lead to cancellation of practicing license. Therefore, the care coordination plans ought to rely on the ethics subscribed to by the different communities. Ethical approach of care coordination is essential in making sure that health practitioners adhere to and support regulations and standards set by the Code of Ethics. As documented by Deswin, the principle of autonomy influences various decision-making as the patient has control and power over what happens to their bodies. Such principles raise consequences when the patient decides otherwise based on their values and principles. Whereas certain interventions could be used to improve their health, such principles greatly influence decision-making and care coordination. Healthcare services in the U.S. are funded through medical coverage that are responsible for paying health organizations and practitioners. Healthcare reimbursement policies may have potential impacts on patient outcomes. Some patients find it convincing that through medical coverage, they can access healthcare services with quality and better outcome. However, the other patients have insurance firms failing to pay for their medical coverage, making it difficult for them to have full access to medical services. As such, patients suffer potential negative experiences with health coverage. The Patient Protection and Affordable Care Act is a good evidence of health policy's positive effect as more than 20 million uninsured individuals have been provided with medical coverage. More so, there have been a vital reduction of uninsured among the poor and those of Medicare programs. Therefore, this is an increase in healthcare accessibility, affordability, and outpatient services among low-income